question, is that a vibe, coding, telegraphing, service levels? And two, will agents have SLAs?
I want to give a slightly different picture of this. You mentioned about metrics and SLAs, which are fantastic when you're thinking about a marketing agent or a sales agent. One of our customers, the largest hospital chain in Netherlands, they are building a reasoning agent for ICU cardiology department on AWS, by the way. And they want the agent to collect symptoms from the customer, or rather from the patient, by asking questions and diagnose what's going on. And here, we're not talking about SLAs and metrics anymore. You're talking about science, absolute science. The chief surgeon has to validate if the agent is doing the right job.
Yeah.
And over a period of time, they want the agents to do most of the diagnosis, but we are so early at this point in time, they are looking beyond metrics and SLAs. They are looking at, can the agent reason pretty well, because it's a very critical function.